IVF is a quite simple process that basically consists on three different phases. The first one is the stimulation, in which patients usually take some injections, mostly subcutaneous injections, that are going to do three different things. One group of injections are going to stimulate the ovaries to create multiple follicles. There are other group of injections that are going to block the natural ovulation of the patient. We don't want the patient to ovulate in a moment in which we don't have a good number of follicles. And the third type of drugs are also subcutaneous injections that are going to be taken at the end of the process, when we are going to trigger the ovulation. Once this ovulation has been triggered, we proceed with the second phase, which is the laboratory phase, in which we first are going to get the eggs in a procedure done in an operation room under a very light sedation. The patient is breathing herself, so we don't need to intubate her, and it takes like 10 minutes to collect the eggs. After that, the man provides the sperm, or we use the sperm from the donor. We inseminate the eggs. In our case, we do ICSI in almost all cases, so that means that we choose a sperm that is injected into the eggs, and then we leave the embryos in incubators called time lapse. Okay, there are different brands, but the technology is called time lapse, until day 5, when they reach the so-called blastocyst stage. On this day, we choose which embryos can be transferred, and the transfer itself is a very easy procedure. It's like if you were going to have a pap smear. You don't need any kind of sedation, and we just place a very thin catheter inside of the uterus, and inside this catheter there is going to be 1 or 2 embryos. After the transfer, you need a couple of hours of resting, and that's it. You can start leading normal life, and as you go through the third phase, which is the 2 weeks, waiting weeks period, until you can have your pregnancy test. During these days where there's nothing special you can do, we really believe that patients can do nothing to change the outcome. So basically, consider yourself pregnant and do all the things that a pregnant woman is supposed to do.